Breaking the Wall of Gynecological Cancers. Bhargavee Gnanasambandam, Falling Walls Lab, Illinois.
Cervical cancer is a completely preventable disease. However, especially because of the current screening tests available, which is the pap smear and a vaccine that is meant to prevent the only cause of cervical cancer, the human papillomavirus. However, this year alone, 602,000 patients are expected to be diagnosed and 342,000 patients are expected to pass away. So, why is it that despite all of this incredible technology, that the rate of cervical cancer remains so high? Our studies indicate that it is actually because of how confusing the current screening process actually is. First, the screening guidelines dictate that patients between the age of 21 and 60 come into the clinic about every 3 to 5 years to get an invasive and also uncomfortable speculum-based exam that gets a cervical sample. The sample is then sent off to a lab where they look for cervical cancer cells as well as cells that have been affected by human papillomavirus. These results can take up to 2 weeks to come back. Next, the patient then needs to be informed of these results and figure out exactly what the follow-up care looks like. As you can see here, this process is incredibly confusing, and it's easy for almost anyone to fall through these gaps. Even more so in the US, it takes about 3 to 6 months to even see a follow-up provider, and this disproportionately affects patients in underserved areas where these same pressures mount, and they ultimately don't even go back for these follow-up appointments. Our solution is intended to solve these gaps. First, our patients are provided with a more comfortable tampon-like device that allows patients to self-swab. The coating of our swab is covered in a pH-sensitive dye that alerts the patient and the provider that they got an accurate cervical sample. Next, the sample is then dipped in a solution and then dripped onto our test, very similar to that of a COVID-19 test, where here 2 lines are positive and 1 is negative. We are looking at both human papillomavirus and cervical cancer, creating a comprehensive cervical screening test using highly established and sensitive biomarkers. Our test is completed within 15 minutes so that patients and their provider within that same visit can immediately create an action plan so that patients aren't worried. After all, it's much easier to begin a line of communication in person where all the resources are already available. Even more so, we have found that we can expand the scope of our device by also detecting ovarian and endometrial cancer, testing for the top 3 gynecological cancers. We believe that this allows women to have more autonomy, breaking down the walls of gynecological cancer. Thank you.